Welcome to our CNS Pharmacology lecture on sedation and hypnotics. In this video, we'll be exploring the mechanisms, clinical uses, and side effects of sedative and hypnotic drugs. These drugs play a crucial role in managing anxiety, insomnia, and preoperative sedation, among other conditions. Understanding their pharmacology is essential for safe and effective use in clinical practice. Let's get started. Classification of sedatives and hypnotics. First, let's look at the classification of sedatives and hypnotics. Sedatives are drugs that calm patients and reduce anxiety without necessarily inducing sleep. Hypnotics are drugs that promote sleep and are primarily used for the treatment of insomnia. There are several classes of drugs that function as sedatives and hypnotics, including 1. Benzodiazepines. These are among the most commonly prescribed sedatives and hypnotics due to their safety and effectiveness. Following are the drugs that come under benzodiazepines. 1. Short-acting, 3 to 8 hours, midazolam, triazolam, oxazepam. You can remember it by Tom. 2. Intermediate-acting, 10 to 20 hours, temazepam, alprazolam, lorazepam, estazolam, clonazepam, clorazepate. You can remember it by TAIL 3. Long-acting, 1 to 3 days, diazepam, flurazepam, chlordiazepoxide. 2. Barbiturates. These older drugs have largely been replaced by safer alternatives, but are still used in certain situations. Following are the drugs that come under barbiturates. 1. Ultra-short-acting. Thiopentyl sodium 2. Short-acting. Pentobarbital. Secobarbital. 3. Intermediate-acting. Amobarbital. 4. Long-acting. Phenobarbital. 3. Non-benzodiazepine hypnotics, also known as Z drugs. These are newer agents that selectively act on sleep-inducing pathways. Following are the drugs that come under these newer drugs category. 1. Zolpidem. 2. Zolpiclone. 3. Zolaplone. 4. Other agents such as antihistamines, antipsychotics, antidepressants, and melatonin agonists also have sedative and hypnotic effects and are used in specific cases. Mechanism of action. Now let's dive into how these drugs work at the molecular level. Most sedatives and hypnotics exert their effects by acting on the central nervous system, particularly through the GABAergic system. 1. Benzodiazepines enhance the action of GABA, the primary inhibitory neurotransmitter in the CNS, by binding to the GABA-A receptor. This increases chloride ion influx, hyperpolarizing the neuron and reducing excitability. Let's see this with a diagram. This is a picture of the GABA receptor. It includes 2 alpha subunits, 2 beta subunits, and a gamma subunit. Let me simplify this diagram a little. This is an alpha subunit, and the next is a beta subunit. This is again an alpha subunit, this is a beta subunit, and this is a gamma subunit. The binding site for benzodiazepines is located between the gamma and alpha subunits. When benzodiazepines bind to this site, it leads to the opening of the chloride channel, allowing an influx of chloride ions. This causes hyperpolarization, resulting in CNS depression. This is how sedation occurs with benzodiazepines. 2. Barbiturates also act on GABA-A receptors, but in a less specific way. They prolong the duration of chloride channel opening, leading to more profound CNS depression. 3. Z drugs, like zolpidem, act more selectively on GABA-A receptors containing alpha-1 subunits, which are associated specifically with sleep induction. 4. Other agents, like melatonin agonists, work by mimicking the action of melatonin, a hormone involved in the regulation of sleep-wake cycles. Clinical uses of sedatives and hypnotics. Sedatives and hypnotics have a variety of clinical applications. 1. Sedatives are used for anxiety management, preoperative sedation, and even for the control of agitation in certain psychiatric conditions. 2. Hypnotics are primarily used in the treatment of insomnia, whether it's sleep onset or sleep maintenance insomnia. 3. Additionally, these drugs may be used as adjuncts in the management of anxiety disorders, depression, and even epilepsy, depending on the drug class. Pharmacokinetics of common sedatives and hypnotics. Understanding the pharmacokinetics of these drugs is crucial for selecting the appropriate agent and dosing schedule. Pharmacokinetics refers to how the body absorbs, distributes, metabolizes, and excretes a drug. Benzodiazepines vary in their onset and duration of action. Some, like midazolam, are short-acting, while others, like diazepam, have a longer duration of action. Barbiturates, such as phenobarbital, are longer-acting and have a higher risk of cumulative toxicity, especially with repeated dosing. Z drugs like zolpidem have a rapid onset and short half-life, making them ideal for sleep induction without significant residual sedation the next day. Factors such as liver function, age, and the presence of other medications can influence how these drugs are metabolized and cleared from the body. Adverse effects and risks. While these drugs are effective, they also come with potential side effects and risks, which need to be carefully managed. 1. Common side effects include drowsiness, dizziness, and cognitive impairment. 2. Benzodiazepines can cause tolerance, physical dependence, and withdrawal symptoms, particularly with long-term use. 3. Barbiturates carry a higher risk of respiratory depression and overdose, which can be fatal. They also have a narrow therapeutic window. 4. Z drugs, though generally safer, have been associated with parasomnias such as sleepwalking and amnesia in some patients. Drug interactions. Drug interactions are a key concern when prescribing sedatives and hypnotics. These drugs can have dangerous interactions with other CNS depressants, such as alcohol, opioids, or antihistamines, leading to enhanced sedation and respiratory depression. Benzodiazepines and barbiturates are metabolized by liver enzymes, and their levels can be affected by enzyme inducers, such as rifampin, or inhibitors, such as cimetidine. Monitoring is essential in patients taking multiple medications to avoid harmful interactions. Summary and conclusion. In summary, sedatives and hypnotics are powerful tools in managing anxiety, insomnia, and other conditions, but they come with significant risks, especially with long-term use. Key points to remember. Benzodiazepines and Z drugs are the most commonly used sedatives and hypnotics, acting primarily through the GABAergic system. Careful consideration of pharmacokinetics, adverse effects, and drug interactions is essential for safe and effective use. Newer agents like dual orexin receptor antagonists and melatonin agonists offer promising alternatives with potentially fewer side effects. Thank you for joining us in this lecture on sedation and hypnotics. If you found this lecture helpful, please like, subscribe, and hit the bell icon to stay updated with our latest content. If you have any questions or topics you'd like us to cover, feel free to leave a comment below. Until next time, stay informed and keep learning.